FeLV, FIV, WTF, that stands for what the feline, of course. Today's episode is all about the kitties. Specifically, a couple of communicable viruses you may or may not have heard of, but you should be aware of as a cat owner. These viruses can have serious, life-threatening consequences. So we'll learn what they are, how your cat can be exposed to them, and how to prevent them. Today, we're baking jalapeno cheddar biscuits. Get it? Because kitties make biscuits? You get it. Let's dig in. Hey, baby. They smell good. These are super good. Welcome to episode 2 of Dig In with Dr. Steph. I'm Dr. Steph, a veterinarian who loves to bake. In my videos, we'll talk about a pet care topic while we bake a fun recipe. If you're more interested in learning how to make these jalapeno cheddar biscuits, skip to the time listed above to skip to the recipe. I also post my recipes and more fun information on my website at drsteph.com. FeLV and FIV, two nasty viruses who can really wreak havoc on your cat's health. You may have heard their names when taking your new kitten to the vet and discussing disease screening and vaccines. FeLV stands for feline leukemia virus, or FeLuke as we sometimes call it. It's one of the most common diseases spread in cats, likely because it's spread so easily. Some people call this the nice kitty virus because it can spread through friendly contact, like grooming or sharing food bowls and litter boxes. But it can also spread via bite wounds between cats or from a mother to her kittens. This virus is aptly named a leukemia virus because that's exactly what it can do. It can cause a cancer of blood-forming tissues, including the bone marrow, or a lymphoma. It can cause blood disorders and suppress your cat's immune system. This is important because immune suppression means cats aren't able to fight off everyday germs that they come in contact with, and they can become ill from an infection overwhelming their body's ability to fight it. The symptoms we see in FeLV infection are variable. Early on in infection, they may show some signs or none at all. Over time though, these patients may show signs of illness or cycle through periods of illness. Cats may be affected by this disease in a variety of ways. They may have a strong enough immune system to clear the virus early on. They may carry a small amount of virus-infected cells for some time, or they may not be able to clear the virus early in the course of infection, allowing it to replicate extensively in the body and actively shed, which means they're able to spread the virus to other cats. The median survival time for cats infected with FeLV is about 2.5 years. Some cats can live relatively normal lives during this time, but it's important to remember that this disease can be spread to other healthy cats. We'll talk about prevention in a bit. FIV. Sounds kind of like HIV, right? That's because it stands for feline immunodeficiency virus, and its course of action is also in its name. The virus attacks the immune system of cats, leaving them susceptible to everyday germs, and thus prone to secondary infections. I like to think of this virus as the spicy kitty virus because it's spread primarily through unfriendly contact, like fighting via scratch and bite wounds. FIV positive cats may develop no signs at all, and some may even live a normal lifespan with this disease. They may also have waxing and waning signs or progressively deteriorate over time. Both FeLV and FIV may be associated with similar symptoms if they develop. They include appetite loss, weight loss, poor hair coat, enlarged lymph nodes, persistent fever, pale gums, infections of the urinary tract, respiratory tract, gums or mouth, persistent diarrhea, neurologic disorders, ocular disorders, and reproductive disorders. Remember that these symptoms are relatively vague, so the presence of any one sign doesn't necessarily mean your cat has this virus. Your veterinarian takes these signs into account, as well as the physical exam and testing in order to make a diagnosis. We'll talk a bit about testing. It's a complicated topic and probably more than you need to know as a pet owner, but you should know that there are a few testing options out there to screen for and diagnose FeLV and FIV. The test of choice depends on the suspect's stage of infection, where or when we are most likely to detect it, and whether the test is better for screening or confirmation. Your veterinarian may recommend different or various tests depending on these factors. Unfortunately, there's no one cure for FeLV or FIV. Depending on the severity of symptoms, secondary infections and anemias may be managed as they happen, but some severely infected patients might not be able to fight it. This is why prevention is key. One of the most important ways to prevent spread of this disease is to avoid contact with other infected cats. This is why you see separate FIV and FeLV positive wards at animal shelters, and why it's risky to adopt a healthy cat if you have a positive cat. If you do have a positive cat, the responsible way to avoid spread is to keep it indoors only. If your cat is negative and an indoor-outdoor cat or an outdoor-only cat, they are at risk for exposure. Cats tend to find other cats when they wander and can easily spread the disease. There is a vaccine for FeLV and, in some countries, FIV. They are not considered a core vaccine and may not provide all cats with complete protection. Your veterinarian may recommend the vaccine and may discuss potential risks and benefits depending on your cat's situation. For more information, there are a lot of great resources out there for you to read as a cat owner, and I will post them to my website at drsteph.com. Pop quiz. What does the L in FeLV stand for? Comment below to answer. Thanks so much for watching. I hope you learned something and maybe learned how to make a fun recipe too. Tune in for the complete recipe at the end of this video and make sure to subscribe to stay up to date.